Hi everyone and welcome back to The Podiatrist TV. We're here at The Podiatrist talking to one of the pods here, Rachel Unsworth, and you're going to talk us through something that you guys see on a daily basis. Really, quite a simple thing, but can cause quite a great deal of pain and discomfort for people. So tell us a little bit about that.
So Chris, we've got Nina here today and we're discussing about partial nail avulsions, which are a treatment that we do really often for ingrown toenails. So ingrown toenails are something that people really suffer a lot with. It's something on a day-to-day basis, particularly this time of year, coming into winter, people are wearing closed-in shoes and all of a sudden they come back with the same sort of niggling pain that they had again last year, and it's something that they try and treat themselves, get in the nail and do the at-home barbershop, not very good. And so they get to us, they've already had a go at it themselves. We can then try and treat it conservatively, but realistically, it's something that could be best treated surgically, which will solve the problem once and for all for that person. So they're not coming back every 12 months when it comes into winter wearing shoes and getting sore toes again.
How does that happen? Because it can happen to absolutely anyone. I've had one before and they can be super painful. So how does it happen in the first place?
Ingrown nails are essentially where the nail presses into the skin that lies adjacent to the nail itself, and it cuts into the skin. So it can be a really acute presentation. So that's generally with patients that are younger, very active. They might play sports which require kicking, so the toe gets inflamed and disrupted. And then it can occur quite chronically. So with our older population, that as time goes on, the nail may experience damage and start to grow in a malformed shape. So the nail can become called curved or involuted is the technical term, and just chronically just irritate the side of the skin adjacent to the nail. So yeah, that's where we come in. And as far as a partial nail avulsion is concerned, it's quite a simple surgical procedure that's performed in the patient chair. I normally get my patient laid back and comfortable, explain the whole situation so they're aware of what we'll be performing. They get a local anaesthetic to the toe to numb the whole toe, and then we go in, take part of the nail. I always make sure the patient's quite happy with the amount that we're taking, because young females in particular can be concerned about the cosmetic appearance.
Yeah, of course.
I had a young lady just the other day, and she'd been putting up with the problem for a long time, and had gone through different experiences and was a little bit traumatized from her background of having to deal with the ingrown nail. And I got her in, and she was quite happy to finally sort it out once and for all. And I sat her down, talked her through, made sure she was happy, ruled a little line on the nail, said, are you happy with that amount? That will get you the relief you're after. And she was quite happy with it. That wouldn't upset the cosmetic appearance. And she came back today actually and was over the moon. So
it's funny, isn't it? Like, it's such a, they could be dealing with it for years, and then you can get them in the chair, a local, and minutes later they can feel relief, almost immediately?
Yeah, pretty well. As far as the surgery is concerned, I say to people to take it steady for a couple of days afterwards, but it's really minimal pain as far as post-op procedure is concerned. The most we ever say to people is, go home, put your feet up, and if need be, take a Panadol, but that's very rare that people have to do that as well. So it's a very impacting sort of surgery that you can get relief from, pretty immediate relief. So yeah. So the point is, if you've got an ingrown toenail and it's giving you pain, don't go DIY on yourself in the back shed or whatever you're doing. Come and see a trained professional like Rachel, like you say, immediate relief. That's Podiatrist TV. Thank you, Nina. Thank you, Rachel, and we'll see you next time.